let's just face it, death is a scary thing. And I think automatically somebody hears hospice to think, well, that's it, that's the end of me.
Hospice was for people who were laying in bed dying.
It is rather amazing to me that after all these years, and hospices all over the country now, that a lot of people still equate the word hospice with people in black cloaks and we're not going to treat you anymore.
A lot of people think hospice is for cancer patients, and that is the only type of patient who's eligible for hospice. When in actuality, only about a third of our patients have a cancer diagnosis. Another third have end-stage cardiovascular disease and pulmonary disease, respiratory disease, and another third have terminal and end-stage dementia, Alzheimer's disease, Parkinson's, those sorts of neurological disorders.
They thought hospice was just for the last couple days of life. They thought hospice was just for patients with cancer. They thought they had to go someplace to be on hospice. They didn't know they could stay at home. They thought they couldn't see their doctor anymore. And we're pleased to find out that's not the case.
We want people to be able to maintain as much of their lifestyle as they can, and that's why we really like to get people onto our program early so that we can maintain that quality, you know, that we can keep pain under control, that we can keep the nausea under control, that they can go out and go to the track, or they can go out to dinner with their family. We don't want them just to be in bed and us trying to get that pain that's out of control under control. We want to get them before it gets to that point so that we can pick up on things early before they become a real problem.
Hospice doesn't mean that the patient will soon die, nor is it only for patients with cancer. And a patient does not have to be bedridden before hospice care is provided. It is also fully paid for by Medicare, Medicaid, and most insurance plans.
I asked a lot of questions, and the questions that I wanted to ask were things that would pertain to me and my care. And I'm telling you that the answers, they were right there with the answers that I wanted to hear for my care. And I was more than satisfied with their answers for my care.
They wanted to do the best. And I appreciate it. Especially Tammy, she calls all the time and make sure everything is, need anything. So it's a wonderful organization.
What I like about what they have done is they've improved the quality of her life by helping her through decisions that need to be made. Yes, the family's involved, but it's really my mother's final say. You know, it's her life, and they are wonderful at explaining options. They have been wonderful in standing up for her on a couple of occasions when we've needed that. They've been wonderful advocates.
They don't realize that we're trying to focus on living and focus on the positive things. Make the best of what time they have left. We never know how much time any of us have, and so we try to focus on the good time and what they do have.
They're going to guide you, you're going to ask questions, they're going to be able to answer them for you. So the best thing is just talk to somebody who knows about hospice, and they can give you all the right answers and help you to walk this painful moment in your life when you need that support and that hand next to you. That would be the best thing that anybody can do. Just call hospice, somebody be there for you.